but I didn't know that I was in. I didn't know that I was in that category for having a stroke. Because I always thought having a stroke is an old person's illness as well, not somebody around my age and everything. But as a Caribbean, no, nobody's sort of point out to me we could be at risk. Well, personally, I didn't feel unwell. I went to my brother-in-law's house after being at my meeting, and then came out to go to my car, and then he was just telling me a quick joke before I went drive home, and everything. And he was telling me a joke. I was laughing. Next thing you know, right, I can hear him shouting or trying to call me, but I couldn't respond to them. And that time I knew I was on the floor, well, and everything, but I couldn't move. So there was no symptoms to say, you know, feeling sick or anything at all. There was nothing to say. I just keel over. He just phoned up the ambulance and everything right. And then what I was told afterwards, they put a pillow under my head because I was on a concrete floor. But they didn't know about could be a stroke or anything. But I was told days afterwards when he phoned up right, um, it's a shame the lady didn't explain to him ambulance was on its way because he was talking to her right about his ambulance coming, but she wanted him to explain what's happened, and then my brother's getting a bit really upset because I was on the floor not moving, couldn't coordinate with what was going on right. I was practically out at that time, so he just wanted somebody to tell him ambulance on his way, and she done that at the beginning, said ambulance on his way, then asked questions afterward. My brother-in-law wouldn't be so getting upset and worried because he thought she just wanted to ask questions without sending the ambulance. So it's a shame she didn't just tell him it's coming. I can ask some questions now. The time he recognised it, I was inside the ambulance really then and all that, and he realised my right arm I couldn't move it at all. My leg was dead, but my right arm because it was hanging down. I couldn't sort of lift it up. So I think that's when he recognised I might have had a stroke, and that's why I think it was brilliant. Because I was told afterward, he rung up before he even left to the Red Hospital. He rung, he made a ring up to tell them that the stroke victim is coming in and all that kind of thing. So I thought it was first class on his part to let them know I had a stroke. But at the time, I still didn't realise what was wrong. So that was, for me, a lifesaver. And then explain to the wife, my brother-in-law, about that drug, the traumatizing, which I call the brainwash. But it helped. And he explained to me days afterward, if I didn't have that particular drug in that 3 hours at the time, that my recovery would have been slower and maybe worse than what it is. So having that, I make a quicker recovery. So that was brilliant. But all because the ambulance driver recognised it and everything. And also Dr. Gupta got his team in, even though it's late at night. After about 4 days in hospital, or 5 days, he brought 3 ambulance staff in to, to show them how important it was to get somebody who had a stroke into hospital as soon as possible so they can have that thrombolyze, right? And so he brought them to talk to me and he showed me, to show them how better I was from when I came in to now or because they got me there in time to have that drug. So I thought it was nice to got a group to done that with the ambulance staff, so to prove a point how important it was to get patients into hospital. If you, if you can recognise someone's got a stroke, please act on it very, very quickly, because it gives the patient chance to have that thrombolyzed drug and everything, and it gives them a chance to have a better class of life.